Moving on, I loved listening to patient stories yesterday. It's really motivating, exciting. That's why we are all here, actually, in one room. Next, I would like to introduce my patient, actually, Mrs. Sally Dale, who came all the way from Iowa to share her story with us. Thank you for coming and making that trip.
First of all, I feel very humbled to be before you guys who hold life in your hands. And I would just encourage you, if you don't make a regular practice to go into your waiting room, to go in and look at the people. It's not a happy place, and often the faces are all looking down. Those who have had good reports, they're a little bit different, but they realize what the other people are doing. So as you think of holding life in your hand, take a look at your waiting room and see the faces of those who you're helping. I'm a 71-year-old woman who has cancer, and I found my cancer when I had COVID in 2021, when I was in the hospital with the COVID. And I was taken down to have a CT scan on my lungs, and the next day, after a really neat experience in the middle of the night, I woke up and I had an enormous peace. And it reminded me of a passage in Isaiah 6:1 that says, I saw the Lord sitting upon a throne high and lifted, and the train of his robe filled the temple. And I was folded into that train. And that peace that I experienced that night stayed with me in the morning when the doctor came and told me that he had found in the CT scan that I had a tumor on my kidney and a large blood clot, and that they were working on getting me an appointment in Iowa City. So a couple days later, I left the hospital with the appointment paper in my hand, and we waited for about 2 weeks before we went to meet Dr. Zachariah and Dr. Packiam. And they put me through a whole bizarre test, lots and lots of them. And I'm not good with strange things, and I'm not good with tests. But at the end of it, the end of May, I came back, and the surgeon said, it's a very high risk. Well, first of all, they said that it was a tumor, and that what they thought was a blood clot was that the tumor had escaped my kidney and was in my vena cava, inferior vena cava, and was laying on my heart. We were told that this condition was only 0.5% in the cases that they see. And he would do surgery. He gave me a date, August 19th, but it would be very dangerous. And probably 5% chance of me surviving it. But in the meantime, this was the end of May. In the meantime, Dr. Zachariah put me on a program, a clinical test of 2 pills for basically it was 2 months. And I went home with the pills in my hand, and my body didn't like it. And I got very sick. I had diarrhea, I had nauseous. I continued to get weaker and weaker. And after one of the visits, I spent a night in the hospital. And during this time, Ross pushed me in a wheelchair. My husband, Ross, pushed me in a wheelchair everywhere I went at the university. On July 4th, I took an ambulance ride from our Indianola, Iowa, to Iowa City, and my thyroid was gone. and it took a few days to get things figured out for that. And by the end of July, I was off the test. I could barely walk from my bed to a recliner that was in my chair. I was extremely weak. In August, I was given some pills to take, 30 days, and I'll tell you this up front, we have very good insurance, but the pills cost $30,000 for 30 days. And I could only take 7 pills. Fortunately, Iowa City's pharmacy had a program that we could return the pills and they would give it to someone who couldn't afford it. And so that's what we did. In September, I started the immune therapy, and that was very good. By December, when the CT scan came, the tumor had been basically cut in half, and the one in my vein was starting to pull away from my heart. And that was good. And from that time on, I felt like I was getting stronger. I got other things. I got C. diff through the time. I got shingles. I got another case of COVID. I got a multitude of things. But I was getting stronger, and that's what counts. In 2022, in March, I went back to through an ER, and I lost my adrenal glands. And that was, took a while again to get things adjusted. I still struggle with, do I take a pill? Do I not take a pill? What do I do? But I was getting stronger. With each passing month, I was getting stronger. And there came a day that I walked into the examining room. And I can remember Dr. Zachariah was very surprised that I walked in. And I was very happy that I was able to do that. 2023 has been a very good year. I'm standing, I'm not using a wheelchair. I'm doing whatever I want to do, but don't tell my husband Ross I will never do windows again. That's something I will not ever be well enough to do. But I'm doing everything else that I want to do. And with each passing, like I said, with each passing month, I continue to get stronger. To the point where in October, Dr. Zachariah put me on a pause for my treatment. And after 2 years, that was a good thing. Not that I didn't mind seeing him every month or going to Iowa City and eating out, but it was good. It was good. And the best thing is that, like I said, I'm getting stronger. And so I go back in December for a CT scan to just see how good I'm doing. And I know I'm doing good. I have some hang-ups once in a while, but 2 years on a medication, I think he said there might be some withdrawal, but that's okay because I've come a long way. This was not a journey that I asked for, but one that I accept. The peace that I felt in April of 2021, that peace that I believe was given to me by my faith in my God, has never left me. It was not always been easy. The days of being sick and weak and not being able to walk, that was tough. Seeing my Ross take care of me with the diarrhea and the throw up, that was tough. He took care of the house and the business that we have all by himself. The hardest was in the morning, which had been my practice for close to 40 years. I would wake up and I would read my Bible, and I couldn't concentrate. That was probably the hardest, worse than throwing up or anything, that I wasn't able to do that. I just couldn't concentrate. We started off from day one every morning saying, this is the day that the Lord has made. I will rejoice and be glad in it. And I set about that day looking for something to be joyful about. Sometimes it was only I didn't have diarrhea, or I made it to the bathroom. Sometimes it was just sitting on the sunroom and looking out at the trees as they moved. But I always tried to find something joyful in that day. This was a time that I had to give up some of the passions that I've had because I just didn't have the strength to do it. And one of the passions I had that for close to 20 years, I taught women about my God. The women in the neighborhood, and in the last few years, women in a homeless shelter that I taught every week. We also worked at a homeless shelter for men in the community, and we served once a week lunch to the people there. I had to give that up. This past year has been good, like I said. I'm getting stronger and healthier. I'm so grateful for the caregivers who always had time to answer my questions, listen to my ramblings and my husband's, and who always had gentle hands and warm smiles. I think of the gentleman that's does the valet parking, and he has a white beard and he has a really nice smile and sparkly eyes, and he would help me with getting into the wheelchair those first days. Ross and I are back serving at the community center and feeding the homeless. I am back teaching women in my neighborhood and at the shelter for homeless women. It has been good. It's a journey. This journey with my cancer was not my choice. But with the help of my God, my husband, and the caregivers that I trust, it has been a good journey. It's not over yet. I have great confidence in my God and in Zachariah, Dr. Zachariah, and his team. Thank you.
Thank you. Thank you so much, Sally. That was very kind of you. Just to clarify, it was very big IVC thrombus, similar to the case that you presented yesterday, Phil, all the way to the heart. It was a clinical trial, those two pills, lenvatinib, everolimus, IIT, we had at the University of Iowa for 2 months only, and that was the program prior to surgery. So just wanted to make that clarification. Thank you again. Moving on to the next session.